I wanted to ask you about asymptomatic testing. I do understand your position on whether this is useful, but for example, travelers who need proof of a negative COVID-19 test for international travel, that may be essential. The film industry has its own guidelines. We're hearing stories of a significant backlog in processing time by Life Labs. What was 48 hours is now 7+ days. Obviously, the priority is tests for those with symptoms. But my question is, should we be relying so heavily on one private processor? What's to say this isn't going to keep happening again and again, even once we catch up?
Yeah, the priority is, of course, to make sure that we can identify cases that may lead to transmission in our community, and that's what we have been focusing on, and Life Labs is an important part of our system here in British Columbia for that public priority. Life Labs had been using some of their capacity to support private testing for asymptomatic people for the reasons you say. They have had some challenges in keeping up with our needs in the public system and being able to support that as well. And I know they and our lab system are working on how we can do that better to support people who absolutely need to have, particularly people who need to travel or have medical procedures in other places done. There's a number of a small number, but people who need a test. And yes, we are working on making that more available for people.
Oh, hi, Dr. Henry. Thanks for this. Just wanted to going back to the tests. We're testing, obviously, many more people than we were in the past, but in the last 2 days, I guess 20,000 people tested negative. How much of a challenge is it to inform these people? I mean, I don't know. Do you have the capacity, the resources to inform 20,000 people in a short period of time that they tested negative? How does that work?
How do you know these things? No, it's obviously this has been some of our challenge. What I am confident in is when a positive test comes up, we are on that very quickly within 24 hours and the person is identified. This is something that we've been following for some time. We have had some challenges in some parts of the province with getting the negative test results out in a timely way. It has waxed and waned depending on the systems. And this is really because we have several different lab platforms, that means the types of the machines in different parts of the province, as well as several different lab networks. So Life Labs, as you know, is a private lab network, and the IT systems sometimes have a challenge talking to each other. We are absolutely working on that to streamline it, and we're coming up with ways that we can try and do both the front end and the back end more efficiently, particularly for people who are negative, because we recognize how much that can interfere with your ability to get back to school or work. So that is a concern that we're working on.
You mentioned that we have a record number of tests done over the past 24 hours, and just wondering if you could elaborate on what is needed now as far as trying to get that process sooner when we're seeing a lack of reagents or the physical stuff that is needed in order for people to do that work properly so that people can get tested.
Yeah, I will also say, just because you brought that up again, our percent positive is actually staying very low, and today it was less than 1% of the tests were positive. So that tells us that we're doing a good job at finding people, and that this is a true sort of leveling off of our cases. There are many things that we're doing. So we think of laboratory testing in the appointment and getting the test done. There's what we call the pre-analytical, so that's, or accessioning, which is the fancy lab term for, it comes into the lab, they make sure there's a name and an identification that goes with each specimen. Looking at ways that we can speed that up. There's ways that we can speed up the process of how the sample is extracted. There's several processes several steps in that process, so that's the analytical phase. Some of those take more reagent than others. There's ways of pooling samples so that we can put 4 samples in a single test run, and because our rates are really low, and that's one of the reasons I mention it, that increases our efficiency because most of them will be negative, and then if one pool tests positive, we go back and test each individual sample from those pooled to see who was the positive person. So those are things that we're looking at. And then on the back end, as I mentioned, looking at linking our IT systems so that particularly the negatives, the positives we're pretty good at, but making sure that the vast number of negative tests get reported out in a more efficient way. And that could mean automatic texts or emails to people. It could mean automatic downloading onto the eHealth website so you can go and check yourself within a period of time. So those are all things we're considering along the whole spectrum of the testing protocol or the testing process. Some of the other things we're looking at as well are the ways that we can reduce the number of people who have to go in to get a nasopharyngeal swab, and we've talked about the gargle and spit test. We hope to have more of the test tubes available sooner so that people who have a hard time with the nasopharyngeal swab or others can access them through more places and do those at home and drop them off at a lab to make that process faster as well.
This GeneTrack Biolabs, Vancouver-based, I believe, it's the only Canadian lab that has received U.S. FDA approval for COVID testing. Is that an option for the province to ramp up the testing with this company?
I have to say I'm not familiar with that company, so I can't answer that question, but we can get some information to you. I do know there's that our lab team is looking at all options, and I know there are some private laboratories that are looking at supporting some of the non-public testing, for example, with industries and travel-related required testing, things like that.
Do you have a follow-up, Lynn?
Yes. What is the backlog that we're looking at of testing right now?
We don't have a backlog of testing. We do within a 24-hour period, all of the tests that have been submitted to the lab have been processed.